This brings our statewide total to 75,943 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 5,953 deaths have now been attributed to COVID-19 in Pennsylvania. Statewide, we are estimating that 71% of individuals with COVID-19 have now recovered. We are also estimating that among long-term care facility residents, 56% have recovered, and in terms of employees, 78% have recovered. We are now aware of 20 confirmed cases of the pediatric condition MIS-C, or multi-system inflammatory syndrome of children. 14 cases remain under investigation. The children impacted range in age from 10 months of age to 18 years of age, with a median age of 9.5 years. We have 3 key announcements for today. First, throughout this outbreak, we have worked to ensure that we have accurate and transparent data for Pennsylvanians to look at how COVID-19 is impacting our state. Today, we are launching a dashboard that provides all of this data in one place. The dashboard includes information at the county and zip code level that we had previously shared and is expanded to include hospital preparedness, demographic data related to cases and deaths, testing information, and reopening status. We also have created a new page on our website for data specifically about long-term care facilities, specifically at this time skilled nursing facilities. Included on this page is the cumulative report of facilities by county, the list of cases by facility, and graphics that show change in case counts over time in these facilities. Second, today, I have issued an order to all skilled nursing facilities, now requiring them to do universal testing and to complete an initial baseline test of all residents and all staff no later than July 24th. Our goal with implementing this testing in nursing homes is to rapidly detect asymptomatic positive residents.
Channel 11 News.
Several members of the Allegheny County Council are planning to introduce a plan that would ban the use of some non-lethal weapons. Councilwoman Bethany Hallam posted this tweet saying, at this Tuesday's meeting, I will be introducing an ordinance banning the use of tear gas, rubber bullets, and flashbang grenades in Allegheny County. The proposal also points out that the use of tear gas in warfare is actually banned by the Geneva Protocol, and that people with health issues like asthma are at increased risk of complications.
Meanwhile, Mayor Bill Peduto has called for change in the way police do business, and that is drawing more criticism. We got a letter last night from Patrick Knepp. He's the vice president for the Pittsburgh Fraternal Order of Police. And in the letter to Mayor Peduto and Chief of Staff Dan Gilman, he says the reforms announced last week are reforms the police department has already implemented since 2015. Knepp went on to say he wants accountability from elected officials, saying in part, quote, I humbly ask all to help unite, not divide. Bring elected officials to the table instead of violence to the streets. You can read the entire letter right now on our website, WPXI.com, or on our WPXI News app, and that is also where you will find the police reforms that the mayor announced last week. In just a few hours, the man accused of murdering George Floyd will be in court for the first time. Former officer Derek Chauvin was initially charged with third-degree murder when he was arrested, but the charges were upgraded to second-degree last week. NBC's Gabe Gutierrez is in Minneapolis with the push to reform the city's police department.
Fired Minneapolis police officer Derek Chauvin is preparing for his first court appearance, facing charges of second-degree murder and manslaughter after the death of George Floyd. Chauvin still declining to publicly comment. The future of the Minneapolis Police Department now uncertain. One day after the mayor was booed for not committing to abolishing the police, a veto-proof majority of the city council pledged to disband the department.
We're not talking about hitting the eject button on the police tomorrow. We're talking about engaging a plan to create a public safety system that works for everyone.
Whether it's dismantling departments or reinvesting in other types of programs, growing demands to defund the police are now being heard across the country. In New York City, Mayor Bill de Blasio is moving some funds from police to youth and social services. In Los Angeles, Mayor Eric Garcetti is pledging to cut as much as $150 million from the police budget. Critics of defunding say less money won't solve the problem.
Defunding is a nice catchphrase, but in reality, you're defunding police organizations that, for the most part, are already significantly underfunded.
All this as more disturbing videos emerge of police arresting black men. In Fairfax County, Virginia, an officer is seen using a stun gun on a man Friday, later hitting him on the head. The officer is now charged with assault. In Alameda, California, police have released this video of an arrest last month, which is also under investigation. The man says he was dancing outside his home.
As for the idea of defunding the Minneapolis Police Department, city council members say it could take up to a year to figure out exactly how that will work. The mayor here says that he wants to reform the department, not abolish it. Gabe Gutierrez, NBC News, Minneapolis.
Pittsburgh Police Chief Scott Schubert is explaining why he joined protesters on Friday and took a knee on West Liberty Avenue. In a lengthy statement, Chief Schubert wrote, "He did it for all the minorities who have experienced decades and centuries of systemic racism and discrimination, for all the peaceful protesters who want real and meaningful change." He also said that he did it for Pittsburgh officers who have focused for years on building bridges within all of our communities. Allegheny County has just released its daily coronavirus update. There are 5 new cases since yesterday, 1 new hospitalization, no new deaths. And of course, those are the kind of numbers that leaders like to see as more and more businesses reopen in this green phase.
Thanks for joining us for your Monday news brief. We'll be back with your severe weather Team 11 forecast.
Channel 11 covers weather everywhere you live.
And we have the experience to get it right.
We know the unique weather patterns across our neighborhoods.
It's why it can be raining in Beaver County,
While it's dry in Westmoreland County.
Weather coverage you can count on.
when news is happening near you, Channel 11 is there.
Aliquippa, Coriopolis, Moon. We cover news everywhere you live.
That's what makes Channel 11 News different.
We're in McCandless, Cranberry, Butler. For news from where you live,
Watch Channel 11 News at 5.
your severe winter Team 11 forecast.
Heat is going to be on the rise. Humidity is going to be on the rise over the next couple of days. I'm Scott Harbaugh, but we're going to be dry today and tomorrow. We've actually been fairly dry most of the month of May and to start off June. I know there have been some periods where we've seen some showers and some thunderstorms from time to time, but rainfall's been below normal for basically the last month and a half. High temperature near 80 this afternoon, 90 degrees Tuesday afternoon, but with the humidity on Tuesday, it's going to feel more like mid-90s later in the day. Abundant sunshine today, so the UV forecast today at 10. It's in the very high range. Keep in mind sunscreen, sunglasses, both a good idea. Sunscreen, SPF 30 or higher, especially for the kids. That's because the sunburn time, this time of the year with a very high sun angle and hardly a cloud around, only takes about 15 minutes. Some people, for sensitive skin, a little bit less. I think tomorrow we might add in limit time outside tomorrow simply because of the heat factor during the day tomorrow. Forecast rest of the day today, lots of sunshine, warm but not humid. 81 for the high temperature today, tonight down to 60 degrees. So not quite as cool tonight as it was first thing this morning. A lot of areas waking up to temperatures in the upper 40s and lower 50s this morning. Tomorrow morning near 60 degrees in the city of Pittsburgh. Suburbs will be in the 50s, but the humidity still won't be a factor tomorrow morning. It will be by tomorrow afternoon. Look at that high temperature, 91 degrees with sunshine and a few clouds. And because of that humidity, that moisture in the air, that makes the air feel heavier, also makes it feel warmer too. So the heat index forecast tomorrow, notice 4 in the afternoon, it's going to feel like 94 degrees. Normal high temperature tomorrow is only 77, so it's going to feel about 15 to 20 degrees warmer than it should for this time of the year. Keep in mind heat safety tips tomorrow. Peak heating normally is from 3 to 7 p.m. So during that time, if you're heat sensitive, limit your time outside. If you do get overheated, take a cool shower or bath. Obviously, keep an eye on the kids and the elderly. Make sure the pets have plenty of water and keep them inside as much as possible. Wednesday's going to be very warm and muggy as well, but scattered showers and thunderstorms will start to move into the area later in the day Wednesday. Some of those storms could be strong. Storm tracker, 7 o'clock Wednesday morning. We're looking fairly quiet. As we go through the day, we'll start to see some showers pop up in the mountains, but the real line of showers and storms doesn't arrive until evening. And notice by 9, 10, 11 o'clock, some fairly strong storms coming through the area. That will set us up for some cooler air again second half of the week. 88 for the high temperature Wednesday with those showers and thunderstorms developing. Then Thursday and Friday, not quite as warm. Still warm for this time of the year, though. 80 degrees on Thursday, 79 on Friday. Humidity will be in check both days, so it'll feel better. And then over the weekend, a little on the cool side. Stray shower or storm Saturday and Sunday, but both days fairly dry, 71 on Saturday.
I mean, you certainly have to wait at least 2 weeks or more because the incubation period of the virus is 2 weeks. And then we are working on sort of what adjustments we could make in the future in the green zones if we show that there's certainly no increase in the number of cases and hopefully continued decreases. So we're pleased to discuss it with them, but we have not come to ground yet on exactly what that new normal will look like in terms of, for instance, occupancy for restaurants and things like that. But we're working on that right now.
How much will the new agreement with PHMC play a role in that?
Oh, not at all. So the agreement with PHC is to work in terms of preparedness with hospitals, but then other healthcare facilities such as nursing homes, EMS, et cetera, the distribution of personal protective equipment, and things like that. It will not influence counties going from red, yellow, green, new normal, et cetera. Yes, April.
Secretary, the Citizens Voice has some questions about universal testing. First, can you explain how nursing homes are expected to go about accomplishing this? Will the department be making test kits available to the nursing homes, or will they be responsible for obtaining test kits?
So we put out guidance in May about how the testing should be done. And for those that need it, we can push out the vials of viral media as well as the swabs that we've obtained from Health and Human Services. For priority facilities, we can arrange for those tests to be done at our laboratory in Exton. Others, again, will work with hospitals that might be nearby or health systems, and then others will work with LabCorp in Quest or maybe even some other companies that do testing. So it's going to be eclectic in a number of different ways to do that. If a nursing home doesn't know how to do it and they're confused, they call us and we'll help them.
On those lines, if nursing homes are having difficulty acquiring test kits, what should they do? Will the Department of Health assist, and how?
Yes, just call us. We'll help make sure it happens.
Do you believe there's adequate availability of test kits to nursing homes in Pennsylvania? If not, when do you expect them to become available?
No, we are very confident of our ability to do this testing now. That is why we started to push it out in May. If you had talked to us in April, we did not have the testing capacity to be able to do this widespread testing in the long-term care living facilities, but we certainly do now.
And then one last question from the Citizen's Voice. What, if any, plans are in place to assist Pennsylvania nursing homes with future costs associated with treating new patient cases of COVID-19 and staff replacement?
Well, we will certainly work with nursing homes and long-term care living facilities in terms of all aspects of caring for these patients. Of course, all of the patients have insurance, predominantly Medicare. Some might have co-insurance with Medicare and Medicaid. So the cost of care is borne by insurance, as it is in terms of hospital care. But we will work with nursing homes to make sure that they have the resources that they need, for instance, personal protective equipment to take care of patients.
Thank you, Secretary. I believe that's all the questions we have for today.
All right. Well, thank you very much. Good afternoon.